Hi, I'm Betty Blevins, Director of Counseling for Hampden-Sydney College. Our counseling service here on campus is free and confidential and unlimited. We work from 8:30 to 5, plus this year we're going to offer some evening hours. We have a variety of male and female counselors on staff. We're located at a confidential spot on the edge of campus in the building right next to health services. We enjoy coordinating with home providers, and we're also able to provide access to psychiatric providers here. We deal with a wide range of issues: adjusting to change, anxiety, depression and other mood disorders, relationship issues, family concerns, grief, LGBTQ, and also substance use concerns. But we also like to work with growth opportunities. We offer career assessment, as well as inventories for personality and values clarification. Each year, I have observed that over 75% of seniors who win awards in their disciplines have been through the counseling center at some point. We also serve a lot of our student leaders on campus. It's quite easy to make an appointment. Simply call Mrs. Traylor, our care coordinator, at 434-223-6411 or stop by. And if I can help you in any way over the summer, answer your questions, or again in the fall, please get in touch with me. I'd love to help. Thank you. Can't wait to see you very soon.
Welcome, class of 2024. My name is Barb, Kiewiet, commonly known as Nurse Barb. I am here representing the Health Center at Hampden-Sydney College. The Health Center is a nurse-directed health center. I, as of June 1st, became the director of the Health Center. I have a bachelor's degree in science and I am board certified in college health. I've been at the Health Center at Hampden-Sydney College since 2002. Our physician is Dr. Timothy Corbett. He is a family medicine physician and a college physician. He has been at Hampden-Sydney since 2000. He is also an Air Force physician. Denise Faircloth is an LPN receptionist, and she has been at Hampden-Sydney College since 2008. She previously worked in the emergency room for 13 years. We're in the process of hiring a primary care nurse at this time. The health center, where is it? It's located at 204 College Road, down from the business office. Currently, the hours are 7:30 to 4. They may change. All of this information may change slightly, but we will update our website and have that available by the time you get here. Especially the MD hours might be changing. Currently, they're 7:30 to 9 in the morning, but I am hoping that those will be changing. We are also changing to an appointment-based way of seeing students, and those processes are being completed this summer, so we will have more information on that too. We do not have a lab or a pharmacy at the health center. Those things are available in town, and we can direct you if at any time those are needed. What do you do if the health center isn't open? We are not open on weekends and evenings. There is a walk-in clinic in the town of Farmville that is open 8 a.m. to 8 p.m. And then there is Central Southside Community Hospital with an emergency room that is also located in the town of Farmville. I mentioned that we don't have pharmacies on site at the college. We do have 4 that are located in the town of Farmville: Walmart, Walgreens, CVS, and Farmville Family Pharmacy. And we can give you more information if you ever need them. The health form requirement is something I'd like to mention. It's very important to all incoming students need to complete the health form. The due date is August 1. We very much need to have those records because they need to be reviewed before you arrive on campus. Where do you find this? Well, you can go onto the Hampden-Sydney website under Student Life, Campus Resources, Student Health, and Student Health Form. There are 4 sections to the Student Health Form. Page 1 and 2 are real easy. They're your demographics and your self-reported history. Page 3, you have to have had a physical done by a healthcare provider within the past 12 months. If it is any time after August of 2019, it is acceptable. The next section of the health form is your immunizations, and we need an official record of that with a physician's signature or from the health department. The last is your insurance information. It's very helpful to send a copy of your insurance card. It is not required, but it's very helpful for your sake to have a copy of that. It can be submitted either by email or fax or sent through the mail. So remember, August 1 on that health form deadline. Vaccines. The health center does offer some vaccines. We have limited availability. We will have the flu vaccine. We have tetanus vaccine. Both of those are available. They're definitely encouraged. They're free of charge. And we'll have more information when they arrive. Other vaccines can be obtained at a lot of local pharmacies, also at the Prince Edward County Health Department, and we'll help you with that if you need other vaccines. Confidentiality. We talk about this a lot on the website, but your information is confidential. There are exceptions. If there is a life-threatening situation, then that is an exception. Release forms are available to send or receive confidential information. Parents, if you're watching this, we can't call you and tell you what's going on with your son or daughter unless they give us permission or call while we're there. But if they explain what's going on and what happened in the health center and seem confused, and you call us and say, well, my son told me this, that, and this, can you clarify? We do feel, since they released that information to you, that we can discuss it. So there is a little bit of a workaround on that if they've already told you the information. Okay, preparing for arrival. This is an exciting time with lots of things to do. Will be on the website and in the parent newsletter a list of supplies that we need you to bring when you come back. This is new, and this is a result of our current situation in healthcare. I'm not going to list them right now, but you should be getting information about them. Just know that everybody needs to have a thermometer and needs to know how to use that thermometer. We also need to know how to wash our hands. There's plenty of information available on proper hand washing. Everybody needs to know that cough etiquette. And you probably should talk to your son or daughter about what you think the best plan would be if they become sick on campus, and maybe discuss the possibility of returning home or what would work best for your family. But those should be some discussions that you have prior to coming to school. Okay, for those who have ADD or ADHD, Dr. Corbett can write prescriptions for your medicine as long as we have copies of your testing, academic testing, that has occurred within the past 3 years. Once those are on file at the health center, then he can manage your ADD medicines. You do have to come in once a month to get your prescription. If you have any questions, you can call and discuss that with us. Some students continue to be followed by their physicians at home and work arrangements out that way. So we'll talk very briefly about COVID-19, not everybody's favorite subject, but obviously this is an ever-changing environment and situation, and we are trying to adapt and change following all of the guidelines that are listed by CDC, ACHA, American College Health Association, and the Virginia Department of Health. So hopefully all that I have said is still going to be accurate in August when you arrive here. I think my most what I would like you to understand is that we are excited and can't wait to have students back on this campus. And we are trying to do everything to make this a safe environment for you. In order for it to be a safe environment, everybody has to be a part and be on board with it. We have to look out for each other. This is a community where we stress that we look out for each other. We have to understand that all of our actions impact other people, and sometimes we have to do things that we really don't want to do but need to do for the health of all, and we really want to get through this difficult semester of, not difficult, challenging new way of living. We understand that probably every family, every person has had some impact from COVID-19, and respect what everybody's story is. Thank you. Looking forward to seeing you. Call us anytime if you have any questions. Bye.
Hey guys, parents, it's so great to know that you guys are going to be here soon. I can't wait to meet you. And we're all getting used to this strange quarantine and video making, but I'm really glad to be talking to you right now. I'm Shawn White. I'm the Assistant Dean of Students for Substance Education at Hampden-Sydney. I've been here for 10 years. I'm starting my 11th year with you guys and really looking forward to it. I do a lot of work with students their entire time here, actually, first year through fourth year, depending. I had a lot of student leaders that work with me on health promotion. I'm the advisor of the No More campaign. I can tell you more about that in a little bit. And of course, you're going to see me a lot, new students with orientation. We want to make sure that your time here is safe and fun. We want to make sure you have all the education that you need to make healthy choices. So a lot of the time I get questions during orientation about, like, what is the current, drug and alcohol climate on campus? So I would say that over my 10 years, there have been significant improvements. In 2009, when I got here, the college had just created the Office of Substance Education. So over time, residence hall infrastructure has improved in terms of accountability and reporting. They do walkthroughs and they have an on-call rotation. Fraternities now are housing RAs. There's just been a significant leadership expansion in terms of our housing, our residence life. We have more head RAs and we have 2 new area coordinators. And it's just been great. It's really good. The students appreciate the RAs because they know that those guys are there for them. And this is Aspen. They know the guys are there for them, the RAs, and that they are there to help. We have had a lot of increased enforcement over the years in my time here, which is also good for the safety and benefit of the community. We have more officers. We have a new software that tracks our conduct, manages that. We require wristbands at parties and tailgates. There's a limit to the number of people who are allowed at parties. We don't allow liquor, and at fraternities or events, fraternity events, no liquor. There's also an increase in the providers at Hampden-Sydney College for students who might need support. We have more counselors on campus with additional outside consultants that we bring in. Basically, in terms of to me, when I think of our culture today, the data speaks for itself. We do these surveys in the last couple of years. We've done 2 surveys. One is the core and the other is a Healthy Mind study. And we've seen lower rates of binge drinking. We've seen lower rates of standard number of drinks among students reporting, and also lower rates of prescription drug misuse. So we've also seen lower rates of other drug use. And those numbers are very telling, and our students are very supportive of the research that we do. We get a good turnabout in the students participating in those surveys. We still have drinking. We still have drinking that goes on, the experimentation. It's all still occurring. We are a college. Students are still arriving with a history of substance use challenges, and students might still complain about things that, we do, these changes that I've discussed with you guys. But overall, the No More campaign that I mentioned earlier, other student focus groups help us sort of impact the perception. And we have a collegiate recovery community that has also been very beneficial. It started in 2014. So students understand that, and they need help. You need to be your brother's keeper while you're here. Students learn from the mistakes others have made, and we prioritize being your brother's keeper, and that perception of these changes that we've made are necessary and they're for the good and for your safety and fun. Other questions I get might be around what are the signs if you know or might think someone is having a problem. So that is pretty standard. It's like, how are they doing in school? How are you having any legal issues with regard to substances? Just depression, signs of depression or anxiety, isolating, maybe getting lonely or homesick, or if you just you're not communicating as much with your family, or parents, if your son is seeming distant. Things like that are important to look for, and be patient and supportive with them. Like, communicate in a non-judgmental way. I tell parents often, be non-judgmental and non-confrontational to the best of your ability. Self-disclose. Tell the guys, guys, my daughter, she's 16. She wants to know, what is my experience with some of the stuff she's going through? So I encourage you parents to share with your sons about your life experience. I encourage parents to be patient, but call us, definitely. And if you are concerned about a friend, you can talk to us. We're a high touch environment, and you're going to see students are going to see other students that need help, and parents might hear about stuff or maybe concerned about their son, and we strongly encourage you to reach out to us. You call me, call Dean Sabatini, contact someone in counseling services or student health services. It is a very serious issue, substance misuse, and students, if they don't have the proper education and they end up in a situation that they don't realize that they're putting their life or someone else's in jeopardy. We don't want that. So by all means, establish a rapport with your RA guys. They're there to help. And parents, get to know your son's RA. Just make sure that you're connecting. Make sure that your son is connected. Get involved, and keep your eyes peeled for people who are there to help, because there's a lot of us here to help at Hampden-Sydney. As far as on that, the resources are pretty clear. You've got counseling services, student health services, Office of Student Affairs, Office of Academic Success. You're going to be required to participate in a legal issues talk where you could learn about the consequences, the policies. So keep in mind that you need to be aware of those things, including bystander intervention. Know that whatever you do could impact your future. So choose your friends wisely and the environments that you put yourself in. At Hampden-Sydney, it's rural and it's all male. So those are some unique challenges that we have with regard to substance, education, substance use challenges that guys face. And there is no judgment, but you do have to ask for help. That is very, very important, is to ask for help. I have tons of programs I could go into. Not going to bother with all of that. You're going to hear about it. The one thing that is so super important for you to get out of my talk right now is the Third Millennium online course you have to complete. All new students at Hampden-Sydney have to do this, and we've been doing it for years. It's very comprehensive. So there's 3 components of the online course. There's 3 online courses that you have to do through Third Millennium. One will be called Alcohol Wise, the other is Marijuana Wise, and then there's Consent and Respect. Those 3 courses, each one's going to take about an hour. So you make sure you don't put it off to the last minute. You can, you'll get an online account with a username and password. You can log in or now, multiple times to finish it. But you will be required to do that, to do those courses through Third Millennium. And those are going to start, it's going to open in like mid to late June, and you have until August 1st. So be sure that you don't procrastinate because it is a student court. It's required by the college before you can come on campus. It's a federal mandate that students have that training, particularly with consent and respect and Title IX stuff. I think I've said enough. I'm at 434-223-6318, and my email is swhite, SWHITE. And I'm just excited about seeing you and helping you grow and be happy here at Hampden-Sydney. Thank you.
Welcome to the Hampden-Sydney Challenge course. My name is Schmolesky. I'm the Director of High Adventure here at Hampden-Sydney College, and I want to give you a brief tour of our Challenge course and talk a little bit about our outdoor program here at the college. Very excited about the Challenge course. You're getting a view of the climbing wall behind us here. What you're not seeing is the upper traversing elements above you. The Challenge course is going on its 2nd year. I was very happy to be one of the first people to see it go in, and very excited to see students get up here and use the low as well as the high course. We call it a high course because it is actually pretty big. It is about 60 feet tall. 52 feet of that is actually the course itself, and our poles are buried about 6 feet into the ground, 6 to 8 feet in the ground. The climbing wall itself, as you can see, has 2 routes. There's a more challenging route on the left and a less challenging route on the right. The wall itself is not terribly technical, but it is long, so it makes it sort of an endurance run as far as the climbing goes. The traversing elements connect to the wall, and while you can't see those, you'll get a chance to see those in person here when you arrive in the fall, and hopefully we'll get you up there in person. The traversing elements have wood, cable, and rope, and you traverse those in sort of a triangular fashion, and certain parts are more challenging than the others, but it's definitely an exciting way to go up there and challenge yourself. And as far as the team building aspect goes, we have our low ropes course behind you, and that is more oriented towards building teamwork between groups, whether it be fraternities, whether it be a sports team, or maybe just a group of guys in the residence hall who want to come out here and kind of work together and sort of gel as a group. So we'll come back down here to the pavilion. I'd like to show you a bit more about what we have indoors as far as our equipment and our gear. Just wanted to answer a few questions you might have about the outdoor program. One of the big questions we have is, do we have gear to rent? We do. We have quite a bit of gear to rent, and you can rent backpacks. You can check out a kayak, check out a bike, check out all sorts of camping gear. We can pretty much equip you for anything outdoors for a day, a weekend, whatever you have an interest in as far as outdoor adventure goes. The other question we have is there a fee for that equipment? There is not. If you're a Hampden-Sydney student, that equipment is all checked out free of charge. So you can come out and check out a kayak for the weekend, as I mentioned, or all you need for a backpacking or camping trip, and there's no fee charged to you. As a student, that's part of your part of the package deal of being a Hampden-Sydney student. As far as outdoor programs go, the Outsiders Club is one I want to mention specifically. This is one of the oldest clubs at Hampden-Sydney and one of the most active clubs at Hampden-Sydney. The club has been in existence since around 1970, and we're very excited this year to be featuring quite a few trips through the club in addition to their what I would call flagship trips, a whitewater trip on the Golly in the fall and a ski trip in the winter. So I'm very excited to have some student leaders who will be leading some other trips to the Outsiders Club, local kayaking trips, rock climbing, hiking, and camping trips will be all on the agenda for the fall. So that's something to definitely take advantage of if you're a student here. As I mentioned, the ropes course is a great team building event as well as an individual challenge for students or a student. And we'll be having regular clinics out there to get you out there on the rock climbing wall, as well as the zip line, which is actually featured behind me. You might not be able to see that right now. We're sitting above Tadpole Hole. But the zip line actually crosses 450 yards above Tadpole Hole, starting on that side of the lake, which you might be able to see, and then finishing up on this side over here. Very exciting experience for the students and a great way to see campus as well. I'm looking forward to seeing you in the fall. Please stop by again, the Office of Student Affairs. I'm in room 303. Again, my name is Schmolesky, Director of High Adventure. I look forward to meeting you this fall.